Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about cracking difficult cases. Just before I jump into the content here, just in case you're watching this on YouTube, if there was an ad playing prior to this video, please note that I don't receive any financial compensation from YouTube for any ads that they run, nor do they approve what ads they run before my videos. So just getting that out of the way. So the vast majority of my practice involves working with patients who are suffering from complex chronic illness. So they have multiple symptoms going on for a long time, difficult to figure out cases, and it's very, very challenging for them, to say the least. And quite frankly, it's challenging as a clinician to figure out those cases. I'm very, very happy to do it, very happy to work with them, but it's challenging on both ends of the spectrum. More challenging for the patients because they're the ones suffering day to day, but it's not an easy field to be to work in. So one of the things that I've found to be really, really helpful over the course of my years, I've been treating complex chronic illness for about 12 years now, give or take, and what I have found is that just being very methodical has been one of the most important things for my practice. Now I understand that being methodical is not very exciting. It's not like oh my gosh, what an earth-shattering concept. This sounds so exciting, but in reality, it actually is really, really important. It's kind of like when people give you advice when you're starting up a business, like be organized, like get your accounting in order. Like how exciting is that? And yet it is so very, very important. And so being methodical with complex chronic illness cases is very important too, because one of the things that I've run into with patients, used to run into it in my earlier years of practice, is that sometimes we'd get overwhelmed, we get discouraged. We got the test result back that showed that there was evidence of borreliosis and Bartonellosis and Epstein-Barr virus, and so we start working with the IVs and the herbs and all the things that are geared at helping to kill off the infection, and then the patient didn't get better, or they barely improved at all, or they just flared a bunch and then didn't really come out further ahead. And it's really disappointing. And when that type of thing still happens in my practice, as it does happen from time to time, it is still disappointing because effort and money and all of that was put into that, and it's always disappointing when plans don't lead to the positive outcomes we're hoping to see. But in my earlier years, in some of those cases, I would, feel pretty dejected, thinking, "Oh man, like I just don't know if I can help this patient. This case is really complicated. The patient's feeling dejected. Like just two dejections is double dejection. They don't cancel each other out. They amplify each other." But what I learned over the course of time was that every case, whether it's incredibly complex or it's modestly complex or maybe not complex at all, there's always a logical explanation for why patients are feeling the way that they're feeling. As much as bad luck is certainly a component of not feel like it's certainly bad luck to have chronic health issues. Chronic health issues don't develop due to bad luck. There's always a physiological explanation as to why those symptoms are happening, why these issues are afoot. And so in a case like that now, if I had a patient where similar scenario, we find all these infections and all their symptoms started after a tick bite or after something that suggested that they certainly very likely acquired an infection, and we treat them for that and it doesn't yield the clinical outcomes that we were looking for. They have a kind of sort of a swing and a miss response to the treatment. Then I certainly acknowledge that. I grieve with the patient for us not seeing good results. Like, I feel genuinely bad for the patient and with the patient. But then it's my job then as the quarterback of their case to say, well, this is what we should do next. You have these symptoms. We've checked this off the list. Well, what else might be contributing to these symptoms? What else might be causing your fatigue and brain fog and chronic pain and bladder issues and bowel issues and all the things that are going on with you? What else might be behind that? And in many cases, when it's not thing number one, it's not thing number two, it's thing number three. And usually by the time we get to number two or number three, we're at least seeing some benefit along the way. Maybe they're not, feeling fantastic yet, but they're at least having some symptom relief. They're starting to get better. We're starting to see the light at the end of the tunnel. So when, and I feel like the undercurrent there to that case management is just being methodical, looking to see, well, what makes sense? We did this, okay, that didn't work, well, what else might still be going on? And that's been really, really important. And thankfully, over the course of time, I've figured out how to be I'd like to think ever more skillful at figuring out, where should we start if this is happening. What point do we pivot? What do we pivot to, so that we're not that we're finding the right therapies and the right therapeutic targets, sooner versus later. It's not like, well, we're going to treat everyone for Lyme, and if that doesn't work, Bartonella. If that doesn't work, Epstein-Barr virus. If that doesn't work, heavy metals. If that doesn't work, mold. There's certainly an order to things that make a lot of sense, and that's really dependent on the patient's history, what symptoms they're experiencing. Of all those symptoms, which ones are the worst? How are they responding to the glutathione they're on versus the antimicrobials they're on? What caused them to herx? What did they have no response to, et cetera, et cetera. So lots of details, and just speaks to probably important principle number 2, besides being methodical, just being an attentive clinician and trying to pay attention as best as possible to little details of the patient case, so we can guide our patients in the most efficient way possible towards the finish line of feeling better. So I hope that information was of interest and useful. If anybody has any questions about this topic or anything else, just post them in the comment section below, and I will answer them if I'm able to.